Got to go? Okay, thanks everyone for joining me here again this morning, and I'm joined by Professor Alan Cheng, who'll speak in a moment. So I'll take you through some of the detail and then confirmation of some of the announcements that we made yesterday. So there are 3 new locally acquired cases of coronavirus, bringing the total number of cases in this outbreak to 63. The 3 new cases are all primary close contacts of previously identified cases, and Professor Cheng will go through the details of those in a moment. So at 11:59 p.m. tonight, Victoria will move to the restrictions I outlined yesterday based on public health advice. And I'll just take you through that again. For Melbourne, that means 5 reasons to leave home for the next 7 days: shopping for food and supplies, authorised work and study, care and caregiving, exercise and getting vaccinated. People will be able to travel further for exercise and shopping with an expanded 10-kilometre radius. Students in years 11 and 12 and students studying 3-4 units of VCE back at school on Friday. A number of outdoor jobs will be added to the authorised list: landscaping, painting, installing solar panels or letterboxing. Other restrictions, including mask wearing, will stay the same. The Chief Health Officer has confirmed this morning that the easing of regional restrictions will occur as planned tonight. So that's great news for regional Victoria. That means lifting the stay-at-home and travel restrictions. All year levels and all students will return to face-to-face schooling. Public gatherings, catching up at a public place like a park or a beach, will be increased to 10 people. Restaurants and cafes can open to a maximum of 50. Retail, beauty and personal care, entertainment venues and community facilities will open in line with density limits. Religious ceremonies and funerals will be capped at 50, weddings at 10. We'll also move to work or study from home if you can, and offices will be capped at 50%. Some things won't change. As we talked about yesterday, visitors to the home are still not okay, and we still need masks to be worn inside. Finally, I want to thank all Victorians for 3 things in particular. First, going out and getting tested. It was a record day for tests yesterday. Over 57,000 people receiving a test. That is an incredible effort, and I want to thank all Victorians. Second, for going out and getting vaccinated. It was also a record day for vaccinations, with over 23,000 administered at our state sites. And third, for doing the right thing over the last 7 days, and for doing the right thing over the next 7 days. We don't do this because we want to, or because it's a choice. We do it because we have to. The Chief Health Officer had no choice but to give government the public health advice that he did, and the government had no choice but to implement those recommendations. We need everyone to follow the rules, like we need everyone to get tested if you have symptoms and get vaccinated when it's your turn. These are the steps that will keep us safe in the coming days, in the coming weeks, and in the coming months ahead. I'll now ask Professor Cheng to go through some of the detail, particularly of those 3 cases, and then we're happy to answer any questions. Alan.
Thanks, Acting Premiers. The Acting Premier said there are 3 new locally acquired cases in Victoria that were diagnosed yesterday. All were primary close contacts of previously identified positive cases, and all were quarantining and in isolation for their entire infectious period, so there are no new exposure sites or public exposures related to those cases. One is a child of a previously identified case in Whittlesea. One is a staff member from the Port Melbourne workplace. And as the facility announced yesterday, one person is a person in their 90s who is a resident at Arcare Maidstone. And that brings the number of cases that are linked to that facility to 5, 4 within the facility. As always, our thoughts are with the Arcare community. We've great faith in the Arcare management and the Western Public Health Unit who are helping the facility manage this outbreak and to protect residents and staff. Just briefly on a number of key settings, there were 2 confirmed cases who attend the North Melbourne Primary School. They're not yet transmissions there, but there are, as you'd understand, a number of close contacts at North Melbourne Primary. That's 243 Tier 1 and 90 Tier 2 contacts identified among both staff and students there. There's testing that's underway, and there's a designated testing lane at the Melbourne Showgrounds today for that group. In terms of Bendigo, we're pleased with the strong testing response in Bendigo after the wastewater detection there, and I can advise that we will be continuing to test known primary close contacts to make sure that they haven't turned into cases in that region today. Pleasingly, the repeat testing from all of the Bendigo catchment wastewater samples are negative, but we still encourage people who are in the Bendigo area with even the mildest of symptoms to come forward for testing. The Acting Premier spoke to record testing numbers. There were 57,519 tests processed. That's a record for Victoria, and thankfully, pleasingly, 85% of those were turned around within 24 hours, and over 98% by the end of the next day. We're revising the vaccination total based on updated information to 23,192, and that's going to be reflected in our cumulative total. So combined with, these are the state clinics, and combined with GP and other clinics, more than 50,000 Victorians got their vaccines yesterday. At the state clinics, 6,226 were healthcare workers, aged care workers and disability care workers as part of our push to get those groups vaccinated as quickly as possible. All the sites were very busy, and you'll understand that there was a wait, and there are active diversions in place to nearby centres to try and share that load. So my message for Victorians is, if you've been out and about, particularly before the lockdown, please check the website to make sure that nowhere that you've been is either a Tier 1 or Tier 2 site, and follow those instructions if you have. If you're at all unwell, please get a test, and don't wait. Every day is critical for our contact tracers. If you're over 40, get a vaccine, or if you're in any other eligible group, get a vaccine. And if you're an aged care or disability care worker, we've got a vaccine for you, and you'll get priority access if you walk up to any of our state clinics. So happy to take questions.
While you're there, Alan, can I ask you about the Arcare latest case?
Yep.
Is it an 89-year-old or someone in the 90s? Because Arcare put out a statement last night saying this person was 89.
I'll clarify that and get back to you. I understand that they are a resident and they are elderly.
And in terms of that case, is that a concern that another resident has tested positive? Are you expecting any further positives to come out of aged care in the coming days?
So Arcare have done very well in terms of infection control, but obviously people that were exposed before they knew about the first cases are potentially still incubating. What's important is that they maintain all that infection control, and there's no further chains of transmission, but obviously it wouldn't be unexpected if more people in the facility became infected.
And with that case in Port Melbourne, Alan, is that related to the Stratton Finance? Is that a retest, or did they only get tested for the first time yesterday?
No, I understand that they tested negative on the first one, and this is the second test that they've become positive. So again, just like they've been exposed, there is an incubation period. They would test negative early in the incubation period and then become positive later.
All three of our new cases today have been linked. If that continues over the next few days of small numbers of linked cases, is there a possibility you could lift lockdown earlier? Or are you too worried about those previously links, I guess, in the cluster, and the fact that that could present problems later?
Yeah. So, I mean, we're reviewing this every day. I think, clearly today is not that day, but we're keeping a very close eye on things, and it really depends on particularly the number of cases that do have community exposures, and with the lockdown and with contact tracing and so on, that number should decrease. I think, so one thing we have been able to do, so as of this morning, we had linked one of those mystery cases to another case. So there are now 3 unlinked cases. There's the first case in the Whittlesea outbreak. There's the first case in the Maidstone outbreak. there's the family that was reported yesterday, whichever the first case was there. There was one other case that lives in the South Melbourne area, and we now, as of this morning, have managed to link that person to another case from an exposure site.
What's the nature of that link? What's the exposure site?
I understand it was at, I don't have the full details, but I understand it was being at the shopping centre at the same time, at the same place.
When you confident with the Brighton Beach hotel case talked about yesterday's challenge, 300% of the transmission occurs at that time.
So whenever we get a positive test, you'll understand that we take action immediately. But we do have a process to examine every result and go back and review them and take repeat tests. There's an expert review panel that is meeting later today to look at the details of that case specifically.
Has there been some...
I'm sorry?
Does that mean it's not 100% of that case?
Every case we look at again, and they go through anything that looks a little bit unusual goes through a review process. That process will be going through later today. I'm not aware of that, but again, we might have to wait till the expert review panel makes a determination on that. Yeah, I know, certainly I don't have the numbers for each testing site with me, but I do understand that there were unfortunately long waits at some of the South Melbourne sites. I think we're generally pretty happy with the response to testing, particularly in the sites where there have possibly been transmissions. And we ask the public's patience. You'll understand with this volume of testing, I think we've tested something like 5% of all of Victorians in the last week. There are going to be waits, but we're doing the best that we can to try and get people through as quickly as possible.
Vaccines, Alan, there are some reports that we're getting of people having to wait when they're trying to get access to Pfizer vaccine if they're eligible. Is there an issue with Pfizer supply at the moment in Victoria?
So in general, there is a constrained supply of Pfizer vaccines. If we had more, then we would be able to give more. But there's a supply chain. It comes from the Commonwealth, and in turn that comes from overseas, and we are making do with what we've got at the moment.
You've been talking about active diversions. Can you just explain to the Victorians listening to this what that actually means? Because they're probably tossing up whether they do walk up as advertised by the government the other day. But how do they avoid that confusion when walking up to the vaccine? If they're staying over here,
so if they're an aged care worker, they get priority. So they've got to bring their, their ID card to show that they're an aged care worker or a disability care worker. But there's a special line for them. For the active diversions, I think there's basically management to say, look, this line's looking really long, but we know that there's a site down the road that has a shorter queue. You might want to go there.
So they don't front the queue with a site that they're actively diverted to?
Not that I'm aware of, but
Other states providing Pfizer over 50 more intensive facilities. Does there need to be a national approach instead of guidelines of how Pfizer's rolled out?
Yeah, I'd support that there's a national guideline. There are always times where Pfizer, for practical reasons, Pfizer's given to people over the age of 50. Probably the easiest example is in a remote community. You don't want to go in with 2 different vaccines, and you certainly don't want to, make mistakes or anything. So in those situations, it's certainly appropriate for one vaccine to be used for the whole population in those areas.
People have been calling the hotline, the vaccine hotline today, have been told that there's no Pfizer left. Is that incorrect information?
We are still vaccinating at the moment. I think in terms of forward bookings, there's a shortage, but I'm not sure exactly when that supply will become available. And we're trying to do the best we can with the supply that we have.
Can you ask other states to give us some of their Pfizer? So that 40-49-year-old
Oh, look, I think we'd always welcome any state that would like to give some of their vaccine to us, but I think that's a matter for so we are delivering. So there is a small stockpile, and we're using those at the moment. I couldn't give you the exact figures, but clearly there's been a surge in demand for vaccines, and there's not the supply to be able to meet that.
Do you have enough to make sure that people who have received their first dose of Pfizer get their second dose in 3 weeks?
Yes, I understand there is. So I'm not across the entire sort of the exact numbers, but we do get some forward predictions on what the supply will come. Obviously, that's dependent on the supply coming in from overseas as well, but we do get a forward prediction, and then we obviously try and put stock aside to make sure that there's enough for second doses and so on. Yeah, I'll have to get those figures. I don't have them. Look, I think at this stage we're comfortable with the prioritisation that we have. There is a process to consider, special groups, but in general there is a balance between, trying to have special groups vaccinated first, and then just getting as many eligible people in as possible to try and make it simple. Look, I think that'll be a matter for the Department of Education, but the public health team certainly work with them closely.
What about paramedics? They were part of 1A, but according to the union, only half have been done. Do you want to see a similar 5-day blitz like you're doing with the aged care workers?
So we'll consider everything, but certainly paramedics have been in 1A and have been eligible from the very beginning of the program, and we'd certainly encourage them all to get vaccinated as soon as possible.
How many police have been vaccinated?
I don't have those figures, but I'll probably get back to you on that.
Do you have those?
I don't have those figures.
How does it apply back to the
Do you agree with the assessment that the infection is spreading faster?
So I guess there's two parameters there. I think it's not really controversial to say that these variants have been shown, or most of these variants have been shown to be more infectious. The way that's often looked at is in closed areas, so like in households, what's the attack rate, what proportion of the people in the household get infected, and for the variants, including B117 and the Kappa variant that we're dealing with at the moment, that has been shown to be higher than for the strain that we were dealing with last year. Sorry, I'll just finish that. So the other thing that we have seen is that people, like the case that we had today where we linked it, there certainly are people that have been strangers to each other that have acquired infection from each other, and we know that they're not, they didn't interact with each other, they weren't at the same cafe, they weren't at the same shop at the same time. And really what that shows is that this is a very infectious virus. Now, it is possible that because of our contact tracing and the careful way that we're taking, travel histories from everyone, that we are picking up some of these cases that way, and so that reflects, contact tracing as well.
What do you think of the critique from some epidemiologists that the language around this strain has been, would you describe it as a beast?
Look, I would say that it's more infectious. I spoke to Professor McCaw this morning, and we certainly agree that this Kappa strain and the Alpha strain are both probably about 50% more infectious than the strain that we had last year. The other Indian variant, the Delta strain, or B6172, is probably even more infectious than that, but that's not the one that we're dealing with at the moment. It's behaving in a different way in the sense that it is more infectious. So, in careful studies, it is more infectious in the sense that more people get infected for every case. So I think that's accurate to say that. The other thing I think that maybe some confusion over is we've talked about this serial interval. So this is the time between when the first person gets sick to the time that the next person they give it to gets sick. That actually is shorter when there's good contact tracing, because people aren't transmitting on the 10th day of their illness. We cut off their transmissibility, and therefore that interval looks shorter. So that's again a sign of good contact tracing, and also the fact that we can pick up transmissions through relatively fleeting interactions.
We said that this current epidemic has 9 value of about 1 to 2. It was above 2, and it's now done below 1. Professor Sutton has likened this variant to measles, which has an R naught value of between 12 and 18.
So
Is it reasonable for things to be made?
I'll just pick you up on something. So there's R naught. R naught is the reproductive number when there's no controls in place at all. And so we think for the wild type virus, for the virus that we had last year, it was probably about 2.5. That figure for the UK variant, the alpha strain, is probably about 3 3/4, and for the Indian, the Delta strain, which is not the one that we have here, it probably is about in the order of 5. But that's when you don't have anything, any controls over the virus. Even before all of this, despite we didn't have lockdown, people were still behaving in a way that they weren't interacting as much with each other and taking care. And so that probably was suppressing the virus to some extent, but it was still able to grow. So it was the effective reproductive number in that situation was around 2.5.
And I'm also sorry.
Yep, sorry. And then as we've tightened up, even just before the lockdown, we think that the R effective was probably around 1.1 to 1.3. We think now, with everything that we're doing now, it probably is below 1, and the national modelling experts estimates put it at about 0.69. Obviously, there's a range of uncertainty around that, but that is lower than 1, and that's encouraging to say that if it won't spread widely, but obviously that's with contact tracing, with everything else that we do.
And I'm also 5 unhindered by contact tracing is still quite different from an R naught of 12 to 18 in measles. Was that a fair comparison for Professor Sutton to make? And I guess, is there a danger if you exaggerate the infectiousness of this, that you lose credibility and people stop listening to you?
Look, I've tried to explain the figures as I understand them. 5, so R naught of 5, which is not the strain that we're dealing with now, is clearly very high for a respiratory virus. There is also the measles, you're infectious over several weeks, whereas with this it's over a shorter period of time. So there are differences, and it's clearly an infectious virus.
With the argument that this strain isn't actually behaving differently, it's good that we know more about it because of the improvements with contact tracing.
Look, I think there's two parts of that. So I think there's the things that can be influenced by contact tracing, that's finding links between cases, but equally careful household studies where households aren't any different than they were last year. They show that there is an increase in attack rate in people that are household members, and that is about the increased infectivity. There's also there's an increased viral load with these strains as well, which is probably an explanation as to why they're more infectious.
So a lot of this guesswork, like you're saying, in a lot of those responses you're talking about the R naughts and R numbers, you're saying we think, like there's actually studies being done on this as we're in this pandemic. Goldie had a look at this. Like, have you got the evidence to back up the rhetoric that your colleagues have been using to describe this virus?
Look, they're very careful studies to look at this. So I've spoken about studies that have looked at household attack rates. That's where you count up the number of secondary, infections there are and the number of household contacts, and they're stratified by age, so that it's not because explained by some other factor. That's they're very careful studies. They've looked at viral loads, so try to quantify the amount of virus in people with and without these variants. In terms of the R naught, there is a range of uncertainty around those, but they're consistently higher. And the Doherty Group have certainly, international leaders in doing this sort of work, and they've made very careful estimates of what they think that is. Yeah, so there's always a distribution of those, and there are a lot of things that feed into these. the measures that we use, what's called the cycle threshold, isn't really the perfect measure for that. You need to do sort of proper studies to work out exactly what the viral load is. And the reason for that is, it's how well you take the swab, and some of those other things, the transport time, how many days since you became unwell also affect that. So it's not something that we can look at easily from the data that we have, but obviously there are much more careful studies done overseas where they can quantify some of those things. Look, we really don't know. We know about 3, and clearly for each of those, there's the person who gave it to them. But it's very hard to know, and that's why we'd really encourage people, even if they have the slightest symptoms, to come forward for testing.
The reports of about 150 to 200 beds in major hospitals are being reserved for COVID patients who can't wait to the workforce. Is there a risk that people will need beds for this out because they're reserving them?
Oh, look, so firstly to say that it's a plan to get beds if they are required, and thankfully they aren't at the moment. Secondly, there are many thousands of hospital beds in Melbourne, and 100 isn't going to impact on that. But clearly there's a plan to make sure that the system is prepared in case things do get worse. But we're certainly hopeful that it won't get to that.
Doctors say that it's not necessary, and none of our people with COVID are in ICU. What can you say to that?
Look, I think there's never a problem in having a plan, and we always need to be careful. We've seen, we've only been going just over a week. I think it's been 10 days since we found the first case. One case has been in ICU. I think another case has been in hospital. We do have cases in hospital, my hospital, the Alfred Hospital, from people in hotel quarantine. We always need to be prepared and have plans in case things don't go the way that you hope.
Alan, just on the cases. Go on. Alan, just on the cases, a question from our colleagues in the state. They just want to clarify this. Regarding the family that travelled into New South Wales, is testing now from the Department of Victoria now confirmed the man who first about heard, has testing now confirmed the man who we first heard about actually catching it from another family member, not the other way around? And we're asking that because New South Wales is now extending that to locations of concern in New South Wales.
So they've done that as a precautionary measure. The expert review panel is meeting later today to consider that. We always need to explore all possibilities. So maybe when we see a cluster, we don't always know who the first one is and how long they were infectious for. But that's being examined. So I understand that's under consideration by HPPC at the moment, and have to wait for that statement to come out. I'm sorry? So in terms of public health interventions, the sort of principle is the least restrictive measure that is required to achieve the goal should be employed. So other things should be explored before we make things mandatory. So we need to make sure that it's accessible, that we've encouraged everyone to come forward. We're doing this blitz in Victoria now, and have vaccinated 6,226 workers yesterday. We want that to continue.
Just quickly, in terms of the data, I know you were heavily involved in the modelling for lockdown last time. What does the data currently show in terms of getting this back to 0 cases? How long is that going to take?
Yeah, so it is difficult to do modelling in this sort of situation where there are relatively small numbers of cases, and I think we made that case as we were trying to come out of lockdown last time. And the reason for that is that it really, when you come down to a few cases, it really depends on who those people are, and that's not easily quantifiable modelling. I think I said before that as a sort of general picture, we think that the effective reproductive ratio is less than 1, so that's encouraging for the settings being right for suppressing this. But again, it comes down to the last few people. If it's, the last person with infection is someone sitting quietly at home without any interactions, then we'll be fine. If it's, a young person that, has been out and about, then, then they could potentially spread it, and that's the reason why we have these lockdowns at the moment, to try and reduce the contacts that everyone has, to prevent infection spreading on. I'm sorry. Look, we really need to look at this every day. It could be shorter, it could be longer, but our best guess at this stage is 7 days would be enough.
Do you think it's wise that we're working towards an 11 stage, or should we be working towards?
Look, I think you don't have to think back very far to know what life was like before we had this outbreak, and I think all of us are really hopeful that we can get back to that, and we can, we won't be able to get back to that immediately. Even after this is over, we need to be cautious, but life was better before this. In terms of trying to locally suppress it, yes. I think, and that's the short-term goal. We want to get back to where we were, a couple of weeks ago. In the long term, really, there's only two ways out. There's either we get vaccinated or we get the virus. We can't hold this forever, particularly in the view of what's happening elsewhere in the world. So we really do need to get this vaccination program out. So we're trying to achieve no community suppression. No community transmission. Sorry.
Just before one more, Alan, is there any argument to opening the vaccine centres longer into the night, 24 hours?
So I understand that they are being extended, the hours are extended, but we are constrained somewhat by vaccine supply as well.
So there's clarity, and we haven't changed the municipalities that are listed. I think there's 31 municipalities that are Greater Metropolitan Melbourne. So that includes my patch, Shive Yarra Ranges. Some of it's very urban, some of it's very rural. But in terms of the identification of those that are under the further 7 days of 5 reasons to leave home, it remains those 31.
How worried are you about an exodus of Melbournians heading to regional Victoria tonight to avoid?
I'm not too worried, to be honest. I think the settings that we have in place, whether it's the 10k limit that will apply for people living in Melbourne, the additional patrols of Victoria Police, the requirement on regional businesses to ensure that patrons coming into their shop is either living in regional Victoria or has a reason to be in regional Victoria. So I think for all of those reasons, I'm not expecting too much of a problem.
How many, just on that, how many police officers will be out and about patrolling?
I can come back to you in terms of the exact number from VicPol, but we're talking about significant increased number of police patrols along all of our arterial routes, 24 hours a day, 7 days a week, as well as spot checks in regional Victoria. So a significant uplift in police activity, and from VicPol's point of view, and we agree, as does Public Health, this is a more effective way to deal with it, rather than have a ring of steel, which is very resource intensive and quite limited in terms of the locations where you can have police based statically, rather than very mobile.
Will fines actually be handed out? Just following on from Richard's question, will fines actually be handed out in regional Victoria should a business find that there's non-compliance?
Yeah, look, there's a suite of enforcement arrangements and fines that can be issued, whether that's people gathering in contravention of the Chief Health Officer's directions, whether it's businesses not doing the right thing. So, I don't want to be standing here sounding punitive. The vast majority of Victorians absolutely do the right thing, but there's a reason why we've got authorised officers who'll be visiting retail outlets, for example, Victoria Police conducting spot checks. There's a reason why we need to have those enforcements, and if necessary, fines will be issued. I know this is a common sense, suite of initiatives that we're asking businesses to do. It's a very simple thing to say to a patron, have you checked in? And that applies everywhere. Have you checked in? And very simple for businesses to say, show us your driver's license to show that you are living in regional Victoria, or if not, evidence that you are appropriately staying in regional Victoria. I think it's a common sense approach, and I think if you talk to most regional Victorians, they would support this. We don't want this virus spreading into regional Victoria. I'm really pleased to be standing here this morning, confirming the easing of restrictions for regional Victoria. I want to be back here next week talking about careful easing of restrictions in Melbourne and further easings of restrictions in regional Victoria. But everyone's got a role to play here. Everyone's got a role to play. It's about people doing the right thing and following the rules, and it's about businesses and others doing the right thing, making sure people are where they should be.
James, with your education hat on, if I could, do you think this last time when you came out of lockdown, lots of students go down and finish students go back to school, have them on a school now? Is that a consideration? Is that something you consider from the state?
Yeah, all of those things are considered, Rich. You know, I'm a father of 3 school-aged children and education minister, and my wife is a teacher. I live and breathe this every single day. I want to see every student at school as quickly as possible. Based on the public health advice for Melbourne, that's years 11 and 12 tomorrow, as well as year 10s doing a unit 3-4. I want to very quickly follow that up with other students and hopefully all students back at school in a very short time. Well, that'll be sure. Yep. As Professor Cheng said today, as Professor Sutton said yesterday, it is a day-by-day analysis about how we are tracking. And you know, if we can do things earlier, we will. But the advice from Public Health has been we need a further 7 days in Melbourne to chase this down to the end. You know, to follow this outbreak, because we cannot afford to let this outbreak let loose in Victoria and beyond our state borders. We've got to drive this to ground, and that's why the advice of Public Health is that we need those 7 days. Every single day, Rich. Every single day. I want students at school. Every parent, every carer wants their child at school. But we've got to follow public health advice. You know, there is absolutely zero luxury to pick and choose the public health advice that we receive. The advice from Public Health is that we are not in a position to have all students and staff back at school right now. And we want to get there as quickly as possible. Importantly, we've got our VCE students back.
Are you going to make them a priority, one of the first things to get back early?
No doubt it's a priority, but it is based on public health advice.
James, how did your discussion with...
So I had a constructive conversation with the PM last night, and he outlined his thinking in terms of support. I made it, my position was very clear to the PM. It would not be reasonable to discount the support that we have already provided to business. You know, over the last few days, almost $500 million in direct support for businesses, and there will be more to come. I've already outlined in coming days, we'll respond to the real challenge for regional tourism and accommodation providers. So we'll come back with even more support. It would be unreasonable to discount that support. Business support is a direct responsibility of the state government, and whether it's last year or the $500 million of support for this particular outbreak, we are meeting our responsibility. In terms of income support for workers, for Victorian workers during this outbreak, that is a responsibility of the federal government. I would be disappointed if we see yet another responsibility that is solely with the Commonwealth walking away from that. That would disappoint me. Well, I think the appropriate thing, the respectful thing, is to let the federal government announce, rather than me announcing or taking you through the detail of my discussion with the PM last night. That wouldn't be appropriate. What I am saying to Victorians today is I had a good conversation with the PM last night. He outlined his thinking. I said it would be unreasonable to discount the support we have already provided to businesses over the last few days, almost $500 million. Business support is a Victorian government responsibility. Support for workers, income support for people that have not got an income due to the COVID outbreak is a responsibility of the federal government, and it would be a real disappointment if they walk away from yet another responsibility that is solely theirs. It was a constructive conversation, as I said, Samaya. He outlined his thinking. I'm not going to be making or detailing that conversation. It's appropriate and respectful to let the federal government make its announcement. I heard the Federal Treasurer say that they'll be having more to say about this today or tomorrow. We just wait to see when they will make it. The point I'm making to all Victorians today is that the state responsibility is supporting Victorian businesses, and we've done that with almost $500 million of support, and we will provide further support. The responsibility of the federal government is income support for workers. That is solely their responsibility, and it would be disappointing if they walked away from that. He outlined his thinking, Simon, and indicated that they will be making an announcement. It's inappropriate for me to talk in further detail. That is for the federal government to make.
You know if that's coming as soon as 1 o'clock? Because, you know, plenty of Victorians are watching this and waiting for this support. Like, is it coming? Like, is there any point in saying it's up to the federal government to step up now? From your understanding, speaking to Scott Morrison, is that support coming? Well,
there's a lot of things we're waiting for when it comes to the Morrison government. You know, we're waiting for a definitive decision on alternative quarantine. We're waiting on whether they're going to support Victorian workers or not. We're waiting on more supply of the vaccine. You know, there's a lot of things that we're waiting for, but the point I'd make, the only way out of this pandemic is the successful rollout of the vaccine. You know, the vaccine is our enemy. Oh, sorry, I'll start again. There we go. That'll run tonight. The virus is our enemy, and the virus doesn't sleep. The virus mutates. The virus thinks that this is a race. Now, I want to take you through some stats. I said yesterday that only 2% of our population is fully vaccinated. Only 2%. Only 2 out of 10 people have received their first vaccine. There are countries around the world where they've got fully vaccinated populations well over 50%. In England, they're almost at 50%. In the United States, they're at something like 52%. In Israel, it's 57%. You know, there are countries around the world that are easing restrictions and getting on top of the pandemic because they have rolled out their vaccine program. We are at 2%. Nationally, we have been woefully, painfully slow. So when we get advice from public health that we need a lockdown, it's a lockdown in an environment where only 2% of our population is fully vaccinated.
James, on your conversation with the federal government, did you discuss the quarantine hubs last night?
We had a brief discussion about alternative quarantine. Look again, it's something that we're waiting for in terms of a definitive answer from the federal government. But I want to make this point really clear. The whole purpose of our proposal for an alternative quarantine facility, not just in Victoria but elsewhere, the whole purpose of an alternative quarantine, a Howard Springs-like facility, is that we make our quarantine system safer. The whole purpose is to ensure that we lower the risk in hotel quarantine. It would be completely and utterly unacceptable to all Victorians if we have a model that does not lower risk in hotel quarantine. Hotels are built for tourists. We need a purpose-built facility for our highest risk travellers. Whether it's from where they come from or who they are, we need a system where our highest risk individuals go to a facility that is purpose-built. Now that is a line that we will not cross. We will not accept a model that doesn't lower risk in hotel quarantine and has an indefinite capacity increase in our hotel quarantine system. This is all about making our state and our nation safer. So that is the key thing. The key thing that in terms of the negotiations and the discussions between state and federal officials, in terms of my discussions with the PM and others, we need to lower the risk in hotel quarantine. We need to have the highest risk individuals going to a purpose-built facility.
Have you been told whether Avalon is the goal?
Look, it's as we've heard from a number of people, we've got 2 sites. Mickleham is our preferred. Avalon would work equally as well, and that is our alternative. That is a call from the federal government. The federal government just needs to give us the tick on the site and the tick on the funding, and we will crack on and get this thing built. And whilst we need it for COVID response, we will operate that facility.
Sure.
Have you been told whether the federal government is happy to pay for that, or whether they're wanting the state to top up on that?
No, we await that answer.
And still on hotel quarantine, you mentioned the need to lower risk in hotel quarantine.
Yeah.
Is it appropriate for medical waste and dirty linen from positive cases in a quarantine hotel to be stored in a car park that 450 residents hold a neighbouring apartment building have access to?
Look, all of this material follows very strict IPC requirements, infection protection control requirements. All of the linen, for example, is treated as if it is a positive case, whether or not the individual is positive or not. So all of the linen is treated as if it is positive. It is put into a bag and tied up. That is done inside the facility. It is then made available for pickup. Very, very strict IPC controls that is followed, and I've been assured of that.
Some of the residents of this building are food delivery drivers who are having to walk past these medical waste and dirty linen bins to get to their bikes to go out and deliver food to Melbourne. Are you comfortable with that scenario?
Look, we follow very strict IPC controls, as I said. All of the bundling of the linen is done inside. It's then sealed in a plastic bag. There is no risk in terms of where it is collected or placed for collection for any individual. These are very, very strict IPC controls.
These residents are also having to use lifts that are also being used by staff of the hotel quarantine facility. Given the record of hotel quarantine, nationwide we've had 21 breaches, a lot of them have caused lockdowns. Is that a risk you're prepared to take?
Rachel, I'll come back to you on the lids of the bins. I'm not aware of that.
Sorry, lifts. People are, residents of this building are sharing lifts with hotel quarantine. Some of whom are carrying waste in and out.
Yep. All I would say is that there are extreme IPC controls, like very, very strict, and we operate on if you see something wrong, absolutely report it, and it is action as soon as possible. You know, I can't stress how much focus and effort goes into IPC controls within our hotel quarantine system. I'll talk broadly. I won't talk to the specifics of the lift. I'll come back to you on that, and I've answered the question on the linen. But a broader commentary on hotel quarantine, as I've said a number of times, it is never a zero risk environment. Never has been, never will be. Hotels are purpose-built for tourists. It's why we have said for so long, and we're still waiting for a definitive response, we need an alternative quarantine facility for our highest risk individuals. And in terms of our assessment about what the federal government comes back with, we whether we give it the tick or not will depend on whether it lowers the risk for Victorians. That's what all Victorians want to see. It's what all Australians want to see. We need to lower the risk of hotel quarantine.
There's one more question on this. It's my understanding that when CQV chose the No Hotel as a quarantine hotel, they didn't realise that this car park, which is shared by the hotel and the apartment building, wasn't the hotels and only the hotels with no access from other people. Given that they now know that, is it appropriate for that? I mean, how can that situation keep going? Should we only be using hotels, all of which are quarantined?
Rachel, you're putting that to me. I'm not aware whether that is the case or not. So I'm very happy to come back to you later.
Yeah, businesses are still waiting for that link to go live today to support. When will that go on? Secondly, is it fair to the feds to kick into Victoria's lockdown when other states, after job filter, WA name it, sending lockdown and didn't get federal support?
Firstly, the applications, as I understand it, will be going live today. I don't have a definitive time in terms of when that will be. I know that any business that have provided their expression of interest in the fund will be notified immediately once it does go live, but I understand it will go live today. And sorry, the second question?
Is it fair for the feds to chip in Victoria's lockdown when other states didn't receive funding in certain areas once job filter run out?
Well, we'll wait and see what the federal government say in terms of the period where their support will come in. So it may well be for the second week of the lockdown rather than the first week, but we'll just wait and see what the feds do. But the point I want to make here is that this is not a choice. We don't choose to go into lockdown. You know, there is no choice. You either run this variant to ground, as we've heard, and you know it's a responsibility of everyone in this media conference and communicating it to the people of Victoria. Professor Cheng today has said that it is 50% more infectious, this variant, than what we saw in 2020. It's what Professor Sutton has said. That's the advice from our public health team. So when we get advice from public health experts that you must go into lockdown and have a series of restrictions in order to run this to ground and ensure it doesn't escape and become uncontrollable, that is not a choice for government. It's not a choice for Victorians. Would Victorians want to see government just ignoring the advice from public health and saying, actually we won't go into lockdown, we won't have restrictions because it's all a bit too hard? That's not a choice available to us. We've got a responsibility to make our community safe and to ensure that people don't get sick and people don't die. That is our responsibility, and we won't walk away from that. And it's frankly insulting for anyone to suggest that any state or territory would choose to enter into a lockdown period to combat this virus.
James, what do you say to Victorian MPs who are campaigning against the federal government giving Victoria
Well, I just think that's disgraceful, and I think if you talk to any Victorian business, any Victorian worker who are so disadvantaged, devastated by the lockdown that we must enter into, they would be appalled that anyone would be advocating to the federal government to ignore the needs of Victorian workers.
QR codes, people don't have to fill your stuff and after each. If there's no, people don't have a smartphone, is there an alternative for businesses to sign people under the new rules?
Yeah, as I understand it, people will log manually the patrons that visit. But I'll come back to you with a definitive answer.
Where's the line drawn for QR codes? Specifically, takeaway coffee, drive-through fast food outlets must be checked into those particular environments.
So we did away with the 15-minute time limit. So we had that for quite some time on the basis that if you stay in one place for a period of time, it's more likely that the virus will transmit. What we have seen with this more infectious and therefore quicker variant, you get a number of cases where it's quite a quick transmission, or it's a transmission where the individuals don't actually meet within that environment. So therefore, the advice from public health is that we need to do away with that 15-minute that 15-minute period where it's not a requirement to check in. So if you're grabbing a takeaway coffee and you're standing for a few minutes as the barista is brewing your coffee, you need to check in.
James, why is it that we're at this stage on track to be out of lockdown by next Friday, that metropolitan Melbourne people are banned from travelling to the regions on the Queen's Birthday long weekend?
Because that's based on public health advice, Simon, is that in a week's time, we expect to be in a position where we can ease restrictions in Melbourne and further ease restrictions in regional Victoria. But the public health advice is that we need to have a period of time, a further period of time, where we have different settings between regional Victoria and metropolitan Melbourne. Unfortunately, that cuts across the period of the long weekend, and that's why I'll have more to say about what support we'll provide for regional tourism and accommodation. I know it's an inconvenience for people. I know people have made plans, but the advice from public health is that we just need to keep metro and regional separate for a bit further.
There's a say that come lockdown, and if it does on next Friday, that there will be some level of restrictions lasting, nevertheless, current restrictions through to the Queen's Birthday Monday, the big Tuesday.
Say again, Tom?
So Queen's Birthday weekend ends on the Monday.
Yep.
Big freezer the day. Is it fair to say there will be a set of restrictions that will at least apply through to that day?
Well, that'll be based on public health advice. It'd be unfair for people if I'm speculating about what might be in or out in terms of the settings that we'll have. It's assessed day by day. We're confident that there'll be some easings of restrictions, but it'll be careful easings of restrictions next week. Once this next period of 7 days is concluded. If we can do things earlier, of course we do. But what those settings are will be based on public health advice.
Back on QR codes. There are a lot of questions about it. It's worth having an education campaign as long as people know exactly what to do.
I think people are pretty accustomed to QR codes. It's a very easy thing to do. Almost everyone has a phone. I know not everyone does, but almost everyone does. Service Vic app, it's a very quick process. I think people are pretty accustomed to it. The change in behaviour will be particularly around supermarkets, for example, or where you're going to get a quick takeaway coffee. So we're working really closely with our supermarket chains. They'll make it as easy as possible for people to check in when they're out shopping.
Will businesses or customers be fined for not checking in and then forcing to check in?
So it's clear in the directions. This is mandatory. So in those retail and hospitality settings, it's mandatory for businesses to make sure that people in regional Victoria, for example, are living appropriately in regional Victoria. We'll have authorised officers visiting supermarkets and other retail settings, making sure that people are following the rules. And what I said earlier, the vast majority of Victorians know what to do and will do the right thing.
So will fines be enforced?
If necessary, of course.
Which authorised officers will be doing those checks and how frequently?
Well, the existing team of authorised officers that we have out at the moment, they cut across a number of departments and agencies. We've got a team of authorised officers, and they'll be out making sure people are doing the right thing. We've got particular people knocking on the doors of primary close contacts, making sure that they're isolating. We've got other authorised officers going into venues, making sure the venues are doing the right thing as well.
We've had reports this week, people going to Bunnings and those were public government checking in, and it's been at the Bunnings, so it's a long location. Is that a problem you're aware of and what's being done to fix it?
I'll come back to you on those, whether there's a technical glitch with a particular venue or location. Overwhelmingly, my experience with the app is You go to the QR code, it comes up with the name of the business. So I think overwhelmingly it's working well. There might be one or two cases where it's a bit glitchy.
Last question.
When it comes to compliance with QR codes and retail outlets, will businesses are putting the right thing in say a month's time and will be doing a crackdown? What's the approach when it comes to compliance?
Well, the approach with compliance is that we'll have authorised officers visiting venues and shopping precincts to make sure that people are doing the right thing, and they'll respond accordingly. We're giving businesses time in terms of making sure that they implement the mandatory check-in, the expansion of the QR codes, but people will do the right thing. I'm very confident about that.
We've come across a video online of going down the queue outside the convention centre, claiming that convincing people one by one not to get the
It's despicable. It's crazy. I think everyone should treat that with the contempt for which it deserves. There's a small number of people that want to ignore the science, ignore the risk. The only way through this pandemic is getting our vaccination rates up from the very low 2% that we are at right now to be in line with other jurisdictions around the world, which have got well over half their population fully vaccinated, significantly more having had at least one vaccine dose. We need to be there. We should be there. We're not there. And the behaviour of these anti-vaxxers, which is a tiny proportion of our community, I think is absolutely despicable.
Look, as I said, we do look at this day by day. If we could stop it earlier, we will. Equally, if the situation isn't looking good next week, we may need to prolong the restrictions. But our expectation is that it will take 7 days, and that's the judgment that we've made at this point. But there's a lot of things that we don't know, obviously. No, I think it'd be fair to say that at this stage, if we had the same situation, we would probably have to do the same thing. But I think as other countries have shown that are ahead of us in the in the vaccination rollout, that things change as time goes on, and with a high vaccination coverage, it becomes easier in some ways to control the virus. That's not to say that variants may change that and other things may change that. But I think the example of other countries is encouraging, that we may not need these sorts of measures once the vaccination coverage gets higher.
So would only be able to provide certainty and have a higher uptake of the vaccine or a higher coverage of vaccine?
Yeah, I mean, I think what we're trying to get to is, where we were before this. We know we can maintain. We had it, I think, for almost 3 months that we were essentially less restricted, much less restricted than we are now. We would hope we can get to that and maintain that.
As the dust settles on this outbreak, our experience in the States, do you think Melbourne is more vulnerable or more unlikely?
Oh, look, I think it's really difficult to know. We don't have thankfully, a huge sample size to say, what might be different. I think there is always an element of luck in this. I think, as I said before, it's, if you have one person in the community with infection, it depends very much on who they are. And we certainly know that, I think it's, 80% of people with COVID don't transmit to anyone. 20% of them transmit to at least someone, and a very small number of people transmit to a lot of people. So there is an element of luck to it. I think it's always difficult to know, to what extent, things like climate and, these are the things that are outside our control. But, India and Singapore and, many other countries are very different climates to Australia. So I'm not sure if that's a huge factor in this.
So, Alan, just on certainty, if
contact tracers can't find a link to those 3 outstanding cases, how long do we have to wait, based on each of those cases, to be sure that there hasn't been further community spread? Is it the full 14 days from when the last one went into isolation, and when was that?
There's a lot of judgment in that. So the the last case that we don't know the origin of yesterday was the one that was reported yesterday. That the family. They did, they have given us a fair bit of detail. We're still looking, and we'll go back and interview them just to see if there's anything else that we might have missed or they might not have mentioned. We'll continue to look into that. We did find the source of one of the 4 mystery cases, so we now have 3. So we'll continue that work. But I couldn't give you an exact time. It really is a judgment.
Is it like a 14-day safety window? Is it longer? How long until you're satisfied that there won't be surprise?
It depends on a lot of things. It's not a hard and fast rule. We look at who the people are, where they've been, the sort of venues they've been in, how infectious we think they were, whether there are other cases that have arisen because of that case. There's a lot that goes into that decision more than just a time window. So we think that it's 1.3 or something, just over 1 as of the 24th of May, and that was with everything that was in place, obviously just before the lockdown and people knowing that there were cases out there. We think that our best guess is that it probably is under 1 because of all the measures that we've taken. So the 5 figure, or that's for the not for this variant, it'd be sort of the high 3s. Is in if you didn't have anything. If we were in 2019 with this virus going around, that's the R that we would expect, and that's what's called R0. The R effective is when there are things in place, and that's what we have now, and that's what clearly we've had for the last year. Obviously, what we have today is different than what we had 10 days ago, and that effect obviously is coming through. We can't know exactly what the R is at this point in time, but based on mobility and other data, we think that it probably is less than 1.
Just one on this thing. Can new parties be there for the birthing and visit after the newborns are born? Say your hospital, say no.
So I'll check on the exact wording. I understand that they can't, but I'll get back to you on the exact wording.
How did they go that long? That was pretty good, all things considered.
That was a bit better than yesterday.